Alternative methods of treatment break down into a number of different areas. Weight reduction to reduce the load on a joint that's failing, muscle exercise programs to maintain power about the joint and motion. So for a hip, for example, I like the use of a bicycle, stationary bicycle. Allows mobility and allows strength. Anti-inflammatory medications to reduce the inflammation from the arthritis. And then injections. Hyaluronic acid injections can help. Cortisone injections may help short term. That's pretty much the gamut of what we have non-operatively. But again, once the arthritis is established within the joint, there's not a lot you can do short of replacing it. Total hip replacement, it can be confusing, that terminology. The reason it's called total hip replacement is that both sides of the joint are replaced. So as opposed to just putting a new ball in, with a total hip replacement, because the arthritis destroys both the socket and the femur, we're replacing both the socket and the femur. That's why it's a total hip replacement. It's not one side or the other, it's both sides of the joint. So on occasion, we will replace both hips. So we'll replace the first hip, and then under the same anesthetic, we'll replace the second hip at the same time. That can be done. Like all forms of surgery, gynecological surgery, urological surgery, orthopedic surgeons have been interested in trying to lessen the trauma of the surgery on patients. And that's something I've been very interested in for the last 8 or 9 years. I think that the surgery we were doing in the past was more radical and extensive than it needed to be done. And I think it's important that if one can lessen that trauma to the patient and the surgery, that the recovery is quicker. On the other hand, there are limitations. The hip replacement is still a replacement of the joint, and minimally invasive is probably not a good phrase to use. It's really less invasive. I think that you need to be experienced in hip replacement surgery to do it well. When I teach about this, what I try to teach surgeons is that we have a very good operation in hip replacement. We don't want to compromise that by making the incision or the approach smaller. You want to do a good job. And it's important that you be experienced to do a good job through these smaller approaches. We currently are doing about 400,000 to 500,000 hip replacements and about the same number of knee replacements. Those numbers will probably triple over the next 20 years. So as the baby boomers now reach the stage where their joints are wearing out, the numbers are exponentially increasing in terms of the need for this operation. We have a very active population, and people are active in their 80s and their 90s. And so they don't want to sit around. So they're driving the system. They want to be up and about and return to activities and enjoy their lives.